Community-based rehabilitation of the patient. Welcome to the series of videos on TRU's mental health program. In this video, Chapter 5 in the 6-part series, we will have a look at TRU's community-based approach to rehabilitate the mentally ill. We've seen in previous videos how TRU makes the treatment easily accessible, free of cost, and in the vicinity of the patient. Our approach is not just limited to diagnosis, and dispensing of medicines, but we also support the family members by home visits to enable the patient to be productive and socially active. TRU encourages regular intake of medicines by the patient as it is an important prerequisite to overcome the illness. The mental health workers are trained to make home visits once or twice a month to ensure that the family gives medicines as per their dosage. They also check if the caretaker visits the clinics to obtain medicines regularly for the patient. Some patients may miss the treatment for some period due to various reasons. The mental health worker then tries to find out the reasons for default and takes up the discussion with the family members to find a solution. The goal of the community-based rehabilitation is to ensure that the patient is able to return to their normal daily lives. As the patient's symptoms improve, the mental health worker plans to take up activities of daily living plan with the family. As this plan is put into action, he or she encourages the family members to help the patient to get control over the daily tasks of living. Over a period of time, the patient is able to perform his or her socially useful role. This plan includes a series of steps to achieve productive activities and socialization. For example, the patient whose daily life was centered at home, step by step, the family members are encouraged to teach the patient various tasks at home. The patient is then encouraged to take up all home chores they were once familiar with and simultaneously to go out into the farm to work if necessary.
એક અમે ગોલ નક્કી કર્યા છે કે કોઈ બેન હોય તો બેન પહેલાં જમવાનું ખાવા બનાવવાનું ઘરનું એટલે સાફ સફાઈ કરવાની વાસણ ઘસવા કે કપડાં ધોવા એ બધું ભૂલી જ ગયા હોય એમને નાની નાની વસ્તુઓ પહેલાં શીખવીએ છીએ. ધારો કે જમવાનું બનાવવાનું હોય તો પહેલાં જે શાકભાજી હોય એ શાકભાજી ઓળખતા શીખવે છે. એના પછી શાકભાજી સમારતા શીખવે છે. પછી જે જમવાનું બનાવવાનું હોય છે એમાં જે મસાલો નાખવાનો હોય એ બધું શીખવે છે. અને અમુક સમય એમનાથી ભૂલ થાય તો ઘરવાળાને સમજાવીએ છીએ કે આ બીમારીને લીધે એમનાથી ભૂલ થઈ છે એટલે કે મરચું મીઠું વધારે નખાઈ ગયું હોય તો તમારે માફ કરી દેવા, એમને વધારે ગુસ્સો નહીં કરવો, બોલવા નહીં એમ. એટલે કારણ કે જો વધારે બોલશે ઘરવાળા તો પાછા પેલા બેન કે કામ નહીં કરી શકે બરાબર, શીખે નહીં. કોઈ ખેડૂત હોય તો ખેડૂતને પહેલાં તો ખેતરમાં શું ઓર્યું છે એટલે શું વાવ્યું છે બધું આમ જાણવા માટે લઈ જઈએ છીએ. એને ગોલ નક્કી કર્યા છે અઠવાડિયા કે 15 દિવસનો. ખેતરમાં લઈ જવા, ખેતરમાં પછી 15 દિવસ પછી આ ઘાસ છે કે આ મકાઈ છે કે પછી આ ડાંગર છે, આ બાજરી છે, બધું ઓળખતા શીખવે છે. પછી એના 15 દિવસે પછી એને ઘાસ કાપવાનું હોય કે એ જે લૂણવાનું હોય, જે મકાઈ થઈ ગઈ તૈયાર તો મકાઈને કાપવાની હોય તો એ બધું એના આગળના પગથિયા શીખવે છે.
Similarly, if a patient is not socializing with outsiders, the family members are encouraged to take the patient along to community events such as marriage ceremonies, bhajans, prayers, and other events. Friends, neighbors, and often children are encouraged to spend time with the patient. Generally, the effort is to create a positive, conducive, and inclusive environment within the family and facilitate communications with the patient. After prolonged medication, efforts of the mental health workers and the family members, the patient usually improves quickly and is found to be taking up socially and economically useful roles in the family, thus overcoming their burden. TRU's approach to rehabilitation of a mentally ill person focuses on working with the community to enable inclusion of the patient and to help them regain most of the tasks they used to perform before falling ill. Our attempt is not to teach new trades or economic occupations to the patients. Instead, we work towards making them find space for useful life on their own and to go back to their original economic activity. When the patient has become economically and socially active, then he or she is said to be rehabilitated.
A patient with severe mental illness is uprooted from his social, economic and productive life. Consequently, he is denied the social respect and they are the victims of stigma by the family as well as in the community. So it is important to help such patients to overcome their symptoms and regain their social and economic life. When such a person starts socializing, he gains his economic role and he is able to get the social respect, then this person is considered to have been rehabilitated. We have experienced that the patient improves faster if he or she lives with the family in the middle of a community, because it provides familiar and supportive environment, relatives' attentions, and above all, caregivers' direct inputs are given to the ill patient's life. Added advantage of such a community-based approach is that the community witnesses how the patient is improving from his illness. The mental health workers plays a dual role by providing direct inputs, direct support to the family of the patient, and also a learning opportunity for rest of the village members. As service provider, TRU's contribution is to identify each gap and impediment for successful treatment of the patient, so that the services really reach the patient in a manner that it is expected to.
Providing only medicines to the mentally ill is not sufficient and is not able to bring back the patient to active life. A comprehensive approach about impediments to treatment, social taboos, and belief structure, family issues and economic status of the patient is required. TRU is able to bring more than 75% of severe mental disorder patients to active and useful social life with the help of community health workers who care for the community. The TRU approach is not only cheap but socially more viable because it's not totally dependent on outside help of professionals.